Hi, I'm Dr. Evan Winograd, a neurosurgeon at North County Neurosurgery in Carlsbad, California. If you're watching this, you or someone you know has probably been told they have a herniated disc in their lower back, and that leg pain, often called sciatica, has you concerned. This video is an educational overview of what lumbar disc herniation is, why it causes those specific symptoms down the leg, and how this condition is generally managed. Please stay for the next slide. There's an important notice before we begin. Before we get into the content, this video is intended for general educational purposes only. The information presented here is not a substitute for professional medical advice, diagnosis, or treatment. Every patient's situation is unique. If you have questions or concerns about your own health, please reach out to your doctor or a qualified healthcare provider for guidance specific to your circumstances. With that said, let's get started. The lumbar spine, the lower back, has 5 vertebrae stacked on top of each other, each separated by a disc. Just like in the neck, think of the disc as a jelly donut, a tough outer ring with a gel center. Inside the spinal canal, below the lowest vertebrae, runs the cauda equina, a bundle of nerve roots that control sensation and movement in both legs and also regulate bladder and bowel function. Most herniations occur at the bottom 2 levels, L4-5 and L5-S1. These levels carry the most load and move the most, so they tend to wear first. A herniation happens when that tough outer ring develops small tears, usually gradually over months or years, not all at once, and the gel center pushes through into the spinal canal. That displaced disc material sits against a nearby nerve root and causes 2 problems: mechanical pressure on the nerve and a chemical inflammatory reaction around it. Both contribute to pain. And here's something important. The inflammation around the nerve is often what's driving symptoms more than the physical size of the herniation itself. That's why pain can be intense even with a relatively modest-looking herniation on MRI. This is what surprises most patients. The problem is in the lower back, but the pain travels all the way down the leg. That's sciatica. The compressed nerve root fires pain signals down its entire pathway into the buttock, leg, and sometimes the foot. The exact distribution of that leg pain tends to correspond to which nerve root is involved. Outer leg and top of foot symptoms typically point to the L5 nerve root. Pain in the back of the leg down to the heel often suggests S1. Those patterns, along with MRI findings, help pinpoint which disc level is the source. Here's what the data consistently shows about this condition. Approximately 90% of people with lumbar disc herniation improve significantly with conservative treatment, without surgery. The body is remarkably effective at resorbing displaced disc material over months, and at calming the nerve inflammation that's driving symptoms. Many patients feel substantially better within 2 to 4 weeks just from the inflammation settling, before the disc material has even fully resorbed. Conservative treatment is almost always the appropriate starting point, and that's where management typically begins. Conservative treatment for lumbar disc herniation generally follows a step-by-step approach. Anti-inflammatory medications, NSAIDs like ibuprofen or naproxen, or a short course of oral steroids, are commonly used to reduce nerve inflammation in the early phase. Activity modification is important. Forward bending and prolonged sitting tend to aggravate symptoms, while gentle walking is usually beneficial. Physical therapy, when introduced as the acute phase settles, focuses on core stability and movement retraining, not aggressive stretching. If significant leg pain persists past 4 to 6 weeks, a targeted epidural steroid injection at the affected level provides meaningful relief in approximately 50 to 70% of patients. Surgery becomes a consideration in specific clinical situations. If conservative measures have been completed and leg pain is still substantially affecting daily function after 6 to 8 weeks, that's one common indication. Progressive weakness, particularly foot drop, the inability to lift the front of the foot, suggests the nerve is being compressed more severely, and that typically shortens the evaluation timeline. And one situation is different from all the others. If there is sudden loss of bladder or bowel control, saddle numbness, or weakness in both legs, that may indicate cauda equina syndrome, which warrants emergency evaluation, not a scheduled appointment. The surgical procedure most commonly used for lumbar disc herniation is called a microdiscectomy. Through a small incision, using a microscope or magnification, the herniated disc fragment pressing on the nerve is removed. The remaining disc is preserved, and no fusion or hardware is typically required. Published outcomes show approximately 85 to 95% of patients report significant relief of leg pain, and that improvement often begins within hours to the first day after surgery. It's generally an outpatient or overnight procedure. Recovery to desk work typically takes around 2 to 3 weeks, and return to more physical activity is usually around 6 to 8 weeks. Most people with a herniated lumbar disc improve steadily over weeks with conservative care. but certain symptoms require more urgent action. Loss of bladder or bowel control, saddle numbness, numbness in the groin or inner thighs, or sudden weakness in both legs are warning signs of cauda equina syndrome. This is a surgical emergency. If those symptoms develop, the appropriate response is to go to an emergency room, not to wait for a scheduled appointment. Progressive foot drop, or leg weakness that is worsening over days, also warrants prompt contact with a spine specialist, rather than continuing to wait. I hope this gave you a clear educational overview of lumbar disc herniation, what it is, why it causes leg pain, and how it's generally managed. A full written patient guide and a treatment decision aid for this condition are both available at northcountyneuro.com. This video is for educational purposes only and does not replace a consultation with your own physician. If you're looking for a neurosurgical evaluation in the North County, San Diego area, you can reach us at 442-273-5056.